what's up? Welcome back to the Lexi's Leukemia Warrior channel. Lexi and I are here today because we are going to be sharing our first video in honor of Childhood Cancer Awareness Month, which is September, right? And we are going to talk today all about Lexi's port, aren't we? You want to show everybody? Can you pull down the shirt? Can everyone see the little bump right there? I think you can, right there where I'm pointing. You can see the bump on Lexi's chest. Right there. And that is Lexi's port. And these awesome shirts were made by a lady at our church for us with Velcro. And then my mom helped tweak them a little bit. You can also find some that have zippers, but I couldn't find them small enough for Lexi. So we call them port shirts, and they're really helpful to just peel down the front so they have good access for when they're putting on her port.
And guess what?
What?
It also got an owl on it.
It does have an owl on it. She loves owls. So should we tell them about your port? So Lexi probably doesn't remember this part, but she got the port installed when she was just 2. And they gave us this little booklet when they installed it. The surgeon came to speak to us. This lists the surgeon's name who installed it. These are little cards that go in my wallet. And then they've got a thing they can scan in case they need any information about it. So basically, the brand is called PowerPort. But what she's got installed is considered a portacath. That's the kind of thing that's installed in her chest. And I love this little book because it comes with Velcro and all the information was inside. It even came with a little bracelet that said PowerPort on it, but it was too big for Lexi. So instead, we got her a different bracelet from Road ID. And it lets people know that she has a port in her left chest. So if for some reason Brian and I were incapacitated and EMTs needed to work on her or something, they would see that and know that that bump is a port in her left chest that could be damaged. And this came with this little book that tells us everything we need to know about Lexi's port. And basically this is what a port looks like. Underneath the chest is kind of that little triangle thing. And so when it's in the person, it kind of raises up like a little cone-shaped triangle. And then underneath of it, there are 3 little bumps. And that is where they stick the needle, is right in between those 3 bumps sticking off the top. And I'll put a picture down that shows where the port actually goes inside of the chest. This is what it looks like underneath. Like they've got a few different places they can install it because they're just trying to get it into the best place possible, into the main vein next to your heart. So in Lexi's case, her port is installed into her left subclavian vein. The reason they put it there is because that is the vein right next to your heart, and they need all of the medication and blood products and whatever she might be receiving in her port. They need it to get there quickly. So that's the best way to do it. She uses her port to get medicine, don't you?
Yeah.
And sometimes they have to give you blood.
After that I'm done, I get blood.
That's right, and we'll talk about that later, won't we?
Yeah.
So they use her port for lots of things. She can get arm pokes to draw labs monthly, but if she's going in for something else and they need labs, they can draw it straight from her port, which is nice. The port can actually set off metal detectors, although we haven't really gone anywhere other than the ER that would have a metal detector. If for some reason we flew or went somewhere that had a metal detector, it could potentially set off the metal detector. So then that's why I keep these in my wallet and this in the diaper bag. It's a little beat up, and that's why. Because we can show them this card and be like, hey, she set off the metal detector because she's got a port in her chest. So, you ready to show them how we access your port?
Yeah.
So we've got her doll here that she loves. She got this doll through a non-profit organization.
Yeah, and I also use it, and I also got my
Yeah, she's got a doctor kit too. This doll comes from the Desi Strong Foundation, another little girl who fought and won against leukemia, and she wanted kids to have someone that looked like them for when they lose their hair and to be able to have a port. So this is actually a little tiny replica of a port, and it's magnetic, so it will stick to the chest, and then the tube comes out, and it's got Velcro on the back of the shirt, and she's got a little hat, but she's not wearing it right now, a little knit hat. And so it even came with a little patch to stick over it, just like real life. So it really helps them to role play and figure out what's going on, especially when she was 2 and she didn't quite understand what was going on.
This was under my doll's shoulder.
So sometimes it's helpful to do role playing, and we do that a lot with the doctor kit, especially early on, and everything else, so that she could express how she was feeling when she couldn't really say it, but she could act it out in the role playing. So you like your doll, don't you? Do you want to hold on to your doll?
Yeah.
So basically, the first thing that happens whenever we get to Children's is in the parking garage, isn't it? What do we do when we get to the parking garage?
We put on my special numbing cream.
That's right. We put on your special numbing cream. This is Lexi's tube of numbing cream, most often called EMLA for the brand. But literally all numbing cream is 2.5% lidocaine and 2.5% prilocaine mixed together. It's similar to what you would find over the counter, like if you went to get some Asper cream or something for like muscle pain or something like that. Asper cream and like Bengay and stuff like that, those are lidocaine, but they don't have the added prilocaine. So that's why this is prescription strength, because it has that extra numbing in it. So you know for sure that that area is going to be nice and numb. And it really does work, because the weekend we got this, before she was going to be accessed the next time, I actually put it on my finger and let it sit there for a while, and then tried to, like, you know, poke my finger with various things, and I couldn't feel it. So it really does work. So what we do is we will, you've seen it in the videos before, peel that down, and I have to wear a glove to put it on, or else my finger will be numb the rest of the day. And you just put a little bit of it right on the top of the port where they're going to stick the needle, just so that it'll be nice and numb. And then I have squares of Glad Press and Seal. Do not laugh. It is a cancer mama's like best tool. We could use a sticker if we wanted, like a big bandage type of thing, but those peel at the skin, and Press and Seal is supposed to be sterile, right? Because you're putting it as a covering over food. So they think that it's safe enough that you could use it to cover up the numbing cream. What it does is it prevents the cream from getting anywhere else on her skin or her clothes, but it creates a good seal so that it doesn't come off. And then when they're ready to peel it off, it just peels right off, and it doesn't pull or tug at the skin at all. The parking garage is the perfect amount of time to put the cream on, because it needs to sit on there for 20-30 minutes, 45 to an hour at the max. And the skin will turn kind of white where the cream started to work. And so by the time we get upstairs and finally get checked in and get a seat, that's the perfect amount of time they told me to leave the cream on. So we just always put it on once we get to the parking garage. Aw, you like your doll, don't you? Yeah. So once we get inside to our chair, I know you've probably seen some of the day in the life videos that we've done. If you haven't, you can go back and watch one of those, and we do include whenever she gets accessed and de-accessed. And so you can kind of see it real time. But basically, once we get there, they get all the pre-stuff taken care of that they can, because, oh, are you tired? Because once they start, thank you. Once they get ready to access her, everything they do has to be sterile. So we actually have some kits at home for if we were, these came from Home Health, like when they had access to her at home when she got some of her chemos at home, because she was getting it like 4 days in a row one day or 1 week. And then they gave us all the extra, because if we were ever traveling somewhere, and we aren't traveling right now, but if we'd ever felt like it was safe enough for us to travel and our counts were decent and if we were somewhere else out of state or we weren't nearby a children's hospital, this kit is a sterile kit, and it's got all of Lexi's size stuff in it. It's got the needle that she uses, everything. So we know that they would have the right size of stuff. Because believe it or not, a lot of regular hospitals, if you aren't a children's hospital, they don't have the smaller needle sizes. Most adults use a 1-inch needle, and kids don't typically use a big size unless they're like a teenager. So younger, smaller kids like her need a smaller 3/4 inch needle, which is what this is. And you can kind of see the needle there on the end.
And guess what? It came with the breathing mask.
Yes, it does. This kit has everything we need.
Yeah.
So basically,
and it also came with the breathing mask if you're ever here that if you need some extra breathe.
yeah, it does come with masks that we have to wear. So basically, unless you have your own mask, which right now during the times of COVID, we all have to wear a mask at the hospital regardless. But before that, they would just give us a mask to wear. And so you have to put on the mask once they open the sterile kit, because everything inside here is sterile, because they are trying to keep things as clean as possible, because you don't want a line infection. You don't want her port to become infected inside, because that's attached to the main artery right next to your heart. And so you could have an infection enter the bloodstream quickly. So if somebody were to sneeze or to cough or whatever, and a droplet flew out while they were trying to access the port or got on any part of the sterile kit, it could be dangerous, because it could introduce bacteria into her line. And that's a serious issue for someone who's already immune suppressed. Even when on the days where I say her counts are good, like that's good for her as a cancer patient. That's not good for a normal child. Like, where they want to keep you at for maintenance is a suppressed immune system, pretty suppressed. So she's quite lower than what the typical child would be. So even when we talk about good counts, that's only relative to her. So what they do is they take the Glad press and seal off, and they use this gauze to wipe off any EMLA that might still be there. That's the first thing they do. And then once they have done that, and they're done messing with her shirt or whatever, and they've got everything in the right place, then they have clean, sterilized, sanitized hands, and they open this kit. Inside this kit, well, this kit actually has masks and everything, because it's a travel kit, but at the hospital, they don't have masks inside the kit because we're already wearing masks at that point because of COVID. But each kit will have its own special pair of gloves inside there. That's important. They don't just grab gloves right out of the box, because, yes, they're nurses and doctors. Their hands are clean, you would think, when they're going in there and grabbing gloves. But, you might go in there and grab a couple pair and your hand might touch another pair. And these kits are super duper duper sterile. So there's a pair of gloves in here that they put on. And I don't know if you can see it, but there at the end of this here is this little foam pad, and it's on a stick. And I don't know if I've ever gotten that part when they're accessing her or not, but it kind of reminds me of a glow stick. So it's basically you take the end of the stick and you just kind of bend it, and you hear this click, and the liquid inside breaks, and it's a sterile cleaning solution, and it gets onto the pad. And then it's like a little sponge, and they literally just use that to clean the area. And she does not like the smell. It's basically like a chlorhexidine type of solution. And they're really trying to sterilize the area where the port is for access. So clean off any bacteria or germs or anything that might be on the skin, any leftover EMLA residue. And once they've thoroughly cleaned that, it's going to be quite damp. They have to let it dry. So while they're letting it dry, she goes ahead and gets everything else on her cart set up. She lays the blue cloth down. These were little paper ones.
But I didn't like and on one of the videos this time, when they take my port out, no blood came out.
That's true. They took your port out one time and you didn't see the dot of blood, did you? So basically the way this works is the needle's in here, and it's encased in this little like plastic tube so that it doesn't like poke you when you're taking it out. And then you pull this little tube off, and then you literally just hold it above those 3 dots, and you have to try to get that needle right into the center, and then you literally just 1, 2, 3 press it in, and you just go. And hopefully you got it in the right spot. This one is like in a separate packaging because these are like to-go packages, but the kits in the oncology clinic, they have the needle already in there, so you have to grab the kit that has the correct size needle, because the only difference is like some kids might use a 1/2 inch needle, like she uses a 3/4 inch needle. The bigger kids, like I say, use an inch needle. Once they have it in, the first thing they do is they, before they even put the sticker on, they have to make sure that they've got it in the right spot. And the only way to know that they have it in the right spot is to do one of these, which is just a basic saline flush. It's just sodium chloride is all it is.
Yeah, but sometimes they have to give you the good medicine and the bad medicine.
Sometimes they do have to give you good and bad medicine. It doesn't smell great. And honestly, kids on chemo, they can totally, like, I don't know what it is, but the nurses have explained to me this phenomenon when they inject things through, like especially heparin or the saline solution. For some reason, the kids can smell it and taste it in their mouth. Like, I guess because it's going into your main vein, like they can just feel it being pushed in, and it kind of manifests itself and you can smell it. So sometimes when you see Lexi going like this, it's because she can't stand when they inject the solution directly into the port. I'm not sure how that works because, you know, I'll never, hopefully, ever have to know. But basically, they just literally squeeze just a little bit of the saline flush in, and then they immediately draw it back out. And they're looking to see if any blood comes out. They want to see it tinged a little pink, because when they draw it out, that means that the port is flushing forwards and backwards, so that when they go to put the medication in, it will completely be clear, no clotting or anything. So if that is good, they'll leave this attached. See, it's got a screw on the end, and all the ends of the tube on the port is screw ends, so that way you can screw things on rather than trying to hold it in there, because you don't want to flush any air into the line either. Yeah, this is the end from her doll's tube, so I can show you. So you need some. Yes, you need it to screw on because you don't want any leaking, you don't want any air getting in, and it's more sterile that way. So they'll leave it attached, and then at that point they're ready to take the sticker. This is the big sticker. You've seen it before. Here's a smaller version, kind of like what she has on her dolly's chest. They call it a Tegaderm. That's the brand it is. And then they've got one here where you can write the date that it was put on if you're going to be wearing it for a long period of time. So basically these are sterile, individually wrapped stickers that are clear over the top, so you can see what's going on with the port, and then it's like a Band-Aid edge. And so that is the best way to make sure that the port stays clean. And sometimes, she's just so tiny, sometimes, you know, the stickers work with you and sometimes they don't, and they get stuck to themselves, and so you end up with more than one sticker on there. But once they've got that on there, they'll go ahead and hook her up to whatever she's getting for the day, transfusions, if it's medicine, if it's chemo, whatever it might be. And anytime they do that, they will actually clean the end of her tube with an alcohol swab for like 10 to 15 seconds, really good, and then let it dry, and then they will attach whatever it is and screw it on, you know, like the tube coming out of the machine for chemo or whatever. And that's just to make sure that things stay really super duper sterile. So once she's all done with everything, all that's left to do is what? Take off your tubie, right? They have got this really awesome, great spray now. You love this spray, don't you? Because it's so much better than the old way, isn't it?
Yeah, the old one is...
Those little sticks, like the little sticks, they would break them and then like rub them all over, and it didn't smell good, and they didn't work as well. They've come out with this new stuff. It's called SensiCare. That's the brand, but it's literally just a sting-free adhesive releaser. You literally just shake this up, and then you just spray it on the bandage.
Yeah.
It kind of reminds me of hairspray. It doesn't smell, no alcohol. It's not supposed to cause any irritation. And it literally saturates the bandage and it releases all the sticky so that when you're pulling it off, it's not pulling at their skin.
And guess what? I did that. We forgot we get a bracelet.
Oh, that's true. She has to wear a bracelet. Anytime they put something through your tubie, they have to scan your bracelet, like what we have on your dolly. We put an old bracelet on her dolly. And when they're doing any type of chemo, they're reading off and verifying with another nurse. So it takes 2 people to start a chemo infusion because they're double and triple checking basically that it's the right medication, the right amount, and it's going to the right person because that's very serious. So once this has been totally saturated, they take it off, and then the port itself, you pull this little clip off, and then this part pulls back and it pulls the needle completely out. So they'll normally, sometimes she has them count, sometimes not, and they go 1, 2, 3, and they yank it, well, nicely, and the needle itself comes right out. The rest of it is there. They're holding on to the rest of it, and they're just pulling this part, and then they can pull the whole thing away with the sticker attached. Then if there's any blood, they'll wipe it off and put a little dotted gauze right there, and then a Band-Aid over it, and that's it. It took us a long time to get to the point where you didn't mind getting your tubie put on and off, did you? That's what we call her port, is her tubie, right? It's your tubie. So what's it like getting your tubie put on? You want to tell everybody what it's like getting your tubie put on?
So it's
Does it hurt at all?
no,
But is it kind of scary sometimes?
yeah,
Because at first you didn't like it, did you? It took a long time for you to learn to like it. Who helps you whenever you get your tubie put on?
Mr. Time.
That's right, Mr. Tyler from Child Life. What does he do?
He distracts me.
That's right. He does distract you with something fun. So that way she's not thinking about getting the tubie put on. She's thinking about whatever Mr. Tyler brought over. And then when you're all done at the end of the day, if you did a good job getting your tubie on, then what?
Get a prize.
You get to go to the prize cabinet and get a prize, don't you? So, what do you want to say to everybody?
I want to,
You're almost done, aren't you?
yeah, I'm almost done with chemo.
That's right. You'll be done in October.
Yeah.
So, since we were talking about ports day, one of the main things that a port can help with is a blood transfusion. And so the organization that we wanted to highlight for this week's video is the American Red Cross. The American Red Cross is the one who does blood drives across the country. And for those who don't know, childhood cancer patients get a lot of transfusions, especially with leukemia because it's blood cancer, but technically all the cancers, even adult cancers, chemotherapy knocks your counts down. It makes your hemoglobin low. It can make your platelets low. I can't tell you the number of transfusions Lexi's had. She's had a lot. On diagnosis, I think she had like 2 or 3 in the span of like a week. So it's very, very important that there is blood for patients, especially Lexi, who is O negative. So she is the universal blood donor, but she can only receive O negative, which I don't think we've ever run into a situation where we've had to wait for blood because they couldn't find it. But definitely O negative, like if they're having trouble getting a hold of one of the others, they know they can give O negative to anybody and they'll just hand it out, and they will. And then you might get to a point where you're like, oh geez, Lexi needs O negative, but they're going to have to try to find some. Luckily, we've never had that situation. But it's thanks to people who donate blood. And I know right now everyone's worried with everything that's been going on. But I have been assured by the American Red Cross that they have totally safe ways for people to donate blood. And they're keeping things very sterile and everyone's wearing a mask. I mean, we're still going into the hospital on a monthly basis wearing our mask, having to have contact with people. It is what it is. So I will link the information to the American Red Cross in the description below. because it's a really great organization and it really is amazing what they do. All the blood drives they have, so that kids like this can receive the blood products that they need. In fact, you know, the immunoglobulin that she receives, when I talk about her IgG and that's low, immunoglobulin is actually pulled from the plasma of like thousands of people. They comb your plasma looking for these antibodies, and that then is what she gets transfused to help give her a boost to help fight off viruses. So thank you so much for watching our video today. We hope you enjoyed learning a little bit about ports and what it's like for a kiddo who has a port. So don't forget to what, Lexi? What should they do?
Hit the bell button, subscribe if you want to see more leukemia videos.
Yes.
Subscribe button below.
She said, subscribe if you want to see more Leukemia Warrior videos and hit the bell button so that you'll be notified every time we post a new video. Thank you so much for watching, and don't forget, you can find us on our other social medias on Twitter and Instagram at Lexi's Leukemia, all lowercase, and join our Facebook group, Lexi's Leukemia Warriors. Thank you, and we'll see you next week. Bye!